Eine Kombinationstechnik.
Ignition key grip as a combined technique using the example of the sternocleidomastoid muscle. Different manual techniques can be combined. Here, for example, I start with the piercing grip and perform a fascial separation technique, technique 4. I pull the sternocleidomastoid muscle away from the underlying scalene muscles. If I now additionally start to twist the muscle, that enhances the separation of the sternocleidomastoid muscle from the underlying scalene muscles. And at the same time, the sternocleidomastoid muscle gets stretched additionally. Stretching is integrated as technique 5 in our treatment concept, so here I combine a technique 4 and a technique 5. If I do this not anywhere in the muscle, but first identify where an active myofascial trigger point is located, and I have here, for example, such an active trigger point, first I can pull away the muscle with the piercing grip, then I twist the muscle, and then I change the piercing grip a little bit towards a pincer grip, with the result that I compress the active myofascial trigger point now, and so I carry out at the same time a technique 1, manual compression of the myofascial trigger point. At the moment I have additionally to the technique 1, the technique 4, fascial separation of the sternocleidomastoid muscle from the underlying scalene muscles, and the technique 5, stretching of the sternocleidomastoid muscle. If my fingers move now, I've replaced technique 1 with technique 2. So I have technique 2A now, plus technique 4, plus technique 5. Or I stay here with my fingers and ask the patient to turn the head slightly to the left and then to turn to the right, to turn to the left, to turn to the right, to one side, to the other side. And so I combine technique 2B with technique 4 and technique 5.